If you were born before 1960, there is a good chance you are losing money every single month, and you don't even know it. I need you to stop what you're doing and stay with me for the next few minutes because this is not a small thing. This is not a one-time bonus, not a rebate, not a stimulus check. We're talking about a benefit that can be worth thousands of dollars every single year for as long as you're on Medicare. There is one form that most people on Medicare have never even heard of. One form, and nobody from Social Security or Medicare is ever going to call you up and tell you that you qualify for this. That is not how this system works. The programs exist, the money exists, but it sits there year after year until someone files the paperwork. If you don't file it, nothing happens. No letter, no phone call, no reminder. I want to be very clear about why this matters, because it's one of the most expensive misunderstandings I see year after year. Most people think Medicare is just Medicare, you pay your premium, you pay your co-pays, and that's that. That's not the full picture. There's an entire second layer underneath Medicare, built specifically for people on a fixed income, and most people never find out it exists until somebody tells them. So today I'm going to walk you through exactly what this program is, who actually qualifies, and it's probably more people than you think, and the one form you need to file to get it. Here's the simple version. Social Security Administration and Medicare work together to create a program for people whose income is limited to help cover the cost of prescription drugs. It's officially called the Part D Low Income Subsidy. Almost everybody just calls it extra help. The reason most people never get it isn't that they don't qualify. It's that no one ever told them this existed. There's no big advertising campaign. It's not mentioned when you first sign up for Medicare. You have to know to ask for it, or stumble onto a video like this one. Now, before I get into the dollar amounts, I want to widen the net a little, because this isn't just for people who consider themselves low income. This isn't just for people who consider themselves low income. It includes people living on a modest pension and Social Security combined. It includes widows and widowers whose household income dropped after a spouse passed away. It includes people who own their home, have a car, have some savings set aside, and still qualify. Based on the current rules, a single person can have an annual income up to around $23,475 and still qualify. For a married couple, that number is around $34725 combined. There are also resource limits, savings, stocks, and similar accounts. But here's the part most people don't realize. Your home does not count. Your car does not count. A life insurance policy does not count. Burial funds set aside do not count. So even if you've done a decent job saving, you may still qualify. Let's talk about what this is actually worth, because this is where it gets real. Social Security itself estimates the average value of this benefit at around $5,700 per person per year, not by a little, not a one-time check. This is a benefit that resets and applies every single year you qualify. Here's specifically what it covers. Point 1. Your monthly drug plan premium. For most people who qualify, Extra Help pays the premium on your Medicare drug plan entirely. That's money you were paying out of your own pocket every single month. Gone. Point 2. Your deductible. Normally, before your drug coverage even kicks in, you have to pay a deductible out of pocket. With Extra Help, that deductible drops to 0. Point 3. Your copays at the pharmacy. Instead of paying full price or a large percentage for your medications, your copay drops to a capped amount. Currently a few dollars for generic drugs and a little over $12 for brand name drugs. Point 4. A cap on how much you'll ever pay in a year. Once your total drug costs hit a certain threshold in a calendar year, your copays drop to 0 for the rest of that year. Everything after that point is free. Not only does this affect your prescription costs, it also affects something people don't expect. If you miss signing up for a Medicare drug plan when you were first eligible and got hit with a late enrollment penalty, qualifying for Extra Help can reduce or eliminate that penalty too. But here's where it gets even more important. This is the biggest misunderstanding I see. People think Extra Help is just about prescription costs. It quietly connects you to an entire category of additional help most people never apply for separately: Medicare Savings Programs. These are state-run programs that can pay your Medicare Part B premium, the one that comes straight out of your Social Security check every month. For 2026, that premium is around $185 a month. When you apply for extra help through Social Security, they can automatically send your information to your state to check you for one of these Medicare Savings Programs too, unless you tell them not to. So one form can open the door to two separate sources of monthly savings. Before you go file anything, check your mail. If you're already enrolled in Medicaid, if you receive supplemental security income, or if you're already enrolled in one of those Medicare Savings Programs I just mentioned, you are very likely already enrolled in Extra Help automatically. You would have received a letter, sometimes called the Purple Letter, confirming this before the start of the year. If you got that letter, you're covered. If you never got that letter and none of those programs apply to you, that's your sign to apply directly. The form you're looking for is the application for Medicare Part D Extra Help, filed through the Social Security Administration. You do not need a third party, a paid service, or anyone charging you a fee to file this. It is free, direct from Social Security. There are 3 ways to do this. 1. Apply online directly through the Social Security Administration's website. 2. Call Social Security at 1-800-8772-1213 and tell them you want to apply for the Part D Extra Help program. If you're deaf or hard of hearing, the TTY line is 1-800-325-777. 3. Visit your local Social Security office in person and ask for the application. You can also get free one-on-one help filling this out through your local state health insurance assistance program, often called SHIP. They don't charge anything, and they're trained specifically to help people with exactly this kind of paperwork. Let's go through this one more time quickly. This program is called Extra Help, also known as the Part D Low-Income Subsidy. It can be worth thousands of dollars a year by covering your drug plan premium, your deductible, and reducing your copays to just a few dollars. It can also connect you automatically to Medicare Savings Programs that may cover your Part B premium. You may already qualify even if you own your home, have a car, and have some savings. And the form to file it is free, through Social Security, no third party needed. If there's one thing I want you to take from this video, it's this. This money does not come find you. You have to ask for it. Check your mail first to see if you're already enrolled. If you're not, call Social Security this week or visit sa.gov and ask specifically for the Part D Extra Help application. These rules and these dollar amounts get updated every single year, and I cover every update the moment it happens. So if this kind of thing matters to you, stay subscribed, because next year's numbers will be different, and I'll be the one breaking down exactly what changed. Thanks for watching, and I'll see you in the next one.